Hello, good evening, everybody. I'm really happy to welcome all of you who have logged in to this webinar today. Each year, September 29th is celebrated as World Heart Day. This is to create global awareness about heart health because diseases of the heart have been one of the major factors that have been adversely affecting the health of people worldwide. This is definitely on the increase, and as in the year 2021, the global death rate, they've accounted for 20.5 million people passing away because of heart-related problems like CVD. This year, the theme has been Don't Miss a Beat. Not wanting to skip this opportunity, the HR team and the medical department at THE have invited a very senior and experienced, eminent Chennai-based cardiologist, Dr. D. Prabhakar, to address us on this topic of concern. We welcome you, sir. And before I request our Chief Medical Officer, Dr. S. Manju, to introduce the speaker to us, I request all the participants to kindly keep your mobile phones on mute or in the silent mode so that it does not interrupt the network. And interaction is very welcome. That is what Dr. Prabhakar has told us. So in case we want to be on the screen and you want to ask him some doubts or clarifications, you are most welcome to. Similarly, at the end of the program, if people want to type in key questions, also you're most welcome to do that. So with this, I request Dr. Manju to introduce Dr. Prabhakar to us.
Thank you, Malin. Good evening, all. On behalf of the Hindu group, I extend a warm welcome to Dr. D. Prabhakar, a renowned interventional cardiologist with over 25 years of experience at Apollo Group of Hospitals in Mehta Nursing Home and his clinic, Ashwin Clinic. He did his MBBS and DM cardiology from Madras Medical College, Chennai. He's actively involved in Lipid Association of India guidelines, and his interest is in hypertension, and he served as a treasurer in the World Hypertension League Congress in Chennai, India, this year. And he has multiple publications and has got multiple landmark studies, and he's a key member of ASSET, which is a notable organization. And he's a national faculty on lipids, hypertension, and heart failure. Over to you, doctor.
Thank you, Dr. Manju. I think that too much of information you're giving people. I don't think you should give this kind of an introduction. Introductions are supposed to say hi. That's all, nothing more than that. I don't want to give you. I wanted to give some statistics on heart attacks. I think Malini has already given that already. So I will not waste much time on that and take you straight into what I want to say. See, heart attacks, all of us know that everybody has a heart problem. Very common scenario. The most common reason why I get a patient who is young is when he comes and says, somebody in my office just collapsed and he just died by the time he reached the hospital. And they come the next day, I have at least 5-6 fellows who are coming into the office. I want a full checkup for the heart to see what is happening. It's a very common scenario nowadays, especially with the IT industry and all that keeps going on. I think this is very, very common. So I think we are seeing more and more heart attacks. So what is the concept of this? Why is there so many heart attacks? And this is my usual thing. I think all of us know about this. It's a very, very age-old saying, which says an ounce of prevention is worth a pound of cure. Nothing more than the traditional cultural methods and values actually exemplifies what happens here. So what I shall be doing over the next, let's say about 20 minutes or to 30 minutes is to keep you occupied on what is happening. Now, I didn't want to stress into the importance of heart attacks. All of us have had at least one heart patient who was there in the family, if not one, more than one. But I thought I'll give you some good news and start and tell you that the UK Biobank study, which is a large database of genetic material and blood, they found out that Indians have a cholesterol that is 10 milligram lower than the Western population. You think it's good news?
Yes.
It has to be good news. Basically, what happens is it has to be a good news because we think that lower levels of cholesterol should translate into lesser of heart attacks. But unfortunately, it doesn't show. Our people tend to be getting heart attacks 10 years earlier than the Western population. Now, mind you, we have a 10 milligram lower cholesterol, but 10 years earlier, we get this problem. 25% of the heart attacks happen in patients who are 40 years or less. 50% of the deaths happen in patients who are less than 50 years of age, while in the European subjects, nearly 90% of the deaths happen beyond 65 years. So I think we should all understand that we are dealing with a much, much bigger problem than all of the problems when dealing with heart attacks and heart diseases. And what are we doing to prevent this? Zero. We don't do anything at all. So what I thought, I will take a simple concept, which is what is mentioned by WHO in the American Heart Association, called Life's Essential 8. Now, if you take care of these 8 important things, the chances of getting a problem are much less. You cannot do away with this. At least you reduce the risk that can happen to you. All of us know about the big 4, the sugars, the cholesterol, the blood pressure, and nicotine exposure. Mind you, I'm not talking about smoking. We are talking about nicotine exposure, because nicotine in the form of either smoking or it could be even chewed tobacco. Both are bad. So both are same. So it is going to be there. Now, this is the big 4. Now, apart from that, there are a few other things that have been mentioned carefully here. If you see here carefully, one is that you notice there is diet, there is physical activity, and there is weight. Both are interrelated. Diet and physical activity ultimately turns down and shows how much you're going to weight. But look at the last part here on top. I hope I can get my laser pointer and it should work, I think. Otherwise, if you can see my arrow, you'll see that sleep is the last factor that comes in and creates a problem. That is important. Now, first, when you start looking at diet, I think it's very simple to say, have a healthy diet. That's very simple. I think avoid oil, fat, butter, ghee, avoid excess salt, take plenty of fruits and vegetables. But that's going to be a very difficult concept to follow. So what we came up with is what is called as a food pyramid. If you look at this food pyramid, the simplest thing is drink plenty of water. That's very, very important. Hydration is important. Apart from that, there are items that are generally for the Western population to eat. So the WHO came up with this particular picture for India. This is a specific picture for India, which translates more or less into this. You eat certain foods sparingly, like the oils, the fats, the fried food. You can have a reasonable amount of milk, yogurt, and the cheese group. Meat, poultry, eggs a little less. Vegetables in plenty, fruits in plenty, and some servings of your basic meal, which is the rice or the millets and the cereals and all those things come in handy. So basically, it's not that what you eat, it's how you eat, how healthy you eat. That's a simpler concept than say, have 2 idlis, don't have vada, have once little bit of sambar and don't have this. It's not going to work out that way. That's a little difficult. So I think have a principle of a diet. Make sure you have a mixture of all these things. That is healthy diet. Salt, the WHO has come up with its own statement and told you clearly that don't take plenty of salt. Avoid all the salty foods because salt long-term has been proven to be destructive. Now, this picture always evokes a lot of interest when I talk about diet. Now, this picture is a very interesting picture. You see this picture, it's got 2 important sayings here on the left. Now, what does this picture actually say? This picture shows 2 important sayings, like I said. The first picture, hope it cooks, yeah. The first picture says, the greatest enemy of man is alcohol, but the Bible asks us to love thine enemy. The second image says, even more interestingly, he who drinks gets drunk. He who gets drunk goes to sleep. He who sleeps does not sin. He who does not sin goes to heaven. So let's all drink and go to heaven. Now, interestingly, this picture was actually featured in Downtown Hindu about a decade ago. This is the collection of my father, which is there in my house, in the drawing room of my house. It came in as one of the rarer collections in the Hindu. Now, what does alcohol do? Because that's the most interesting thing that everybody wants to talk about. And what does this say? Moderate alcohol consumption, everybody says is good, but it is not. The benefit and the results that have shown these results are very, very small and inconsistent. So if you're going to take alcohol of more than 30 grams a day in women or 45, 30 grams will translate into probably about a drink, 1.5 drinks in men. And that should probably translate. If you go more than that, there is an increased cardiovascular risk. It's not that the benefits of alcohol are consistent. So remember, alcohol is also notified as a carcinogen, and you can develop cancers if you take alcohol. So mind you, be careful with alcohol. I'm sure there'll be a lot of questions on this, which we can take later. Once you talk about diet, the next important thing, Doc, you have to balance it, like I already said, is the exercise. The WHO's recommendation is very, very simple and clear. 30 minutes of physical activity like walking or 25 minutes of jogging. The total per week can be about 150 minutes of walking or 75 minutes of jogging. That's fair enough. But look below that. You need at least 2 days of weight training. That is very, very important. That weight training is the one that maintains your muscles and long-term benefits. But if you look at patients who are diabetic, hypertensive, and heart disease, the duration of exercise cannot be 30, it has to be 40 minutes a day, most days of the week. You have to be fit, you have to move more, increase your intensity if you're doing your exercise already, add muscle, that's where the weights come in, and definitely you start feeling better. Now, this is a very simple concept. But today we have gone to the digital era. So what everybody does, everybody has this Fitbit watch and they start walking. And what about the digital era? What is the amount of exercise that you have to do? A sedentary woman normally averages about 2,700 steps a day. Even at 4,000, 4,500 steps, there is a reduction in mortality for women. And the benefits start accruing going up to 7,500 to 10,000 steps. Now, 7,500, it kind of tapers off, but there is going to be weight loss up to 10,000. So if you're going to do 10,000 steps a day, you will notice some weight loss unless you're going to be hogging a lot of food. So remember, there's a balance between what you eat and what you burn. So your digital era is something that you can use. And in fact, I have noticed that a lot of these women who don't move around much in the house, they say, I keep doing a lot of work in the kitchen. I go here, there. You ask them to buy one of these watches, can do the step count. They definitely increase their activity and weight loss is facilitated. Now, like I said, it is very, very important to balance what you eat and what you burn. But how do you do and find out what is obesity? The simplest measure is your waist circumference. If your waist circumference is more than 90 centimeters in Indian men or 80 centimeters in Indian women, you are in tune for a metabolic syndrome or obesity. It's very simplest measure. If you're looking in terms of weight, your height in centimeters minus 100 is the maximum weight that you can have. That's going to be simple. So that is going to be a very simple methodology, but the waist circumference today has been found to be more useful and it is measured in expiration. That's important. Now, whenever we talk about diet, everybody keeps talking about this time-restricted eating or this not eating for 12 hours, 14 hours. This is actually called time-restricted eating or intermittent fasting, as they call it. Now, what has been found is that just restricting the calories is the same as intermittent fasting. So don't waste your time fasting. Eat, but eat it, spread it over time. You won't get gastritis. The benefits are exactly the same. This is a scientifically published paper, which is there online. You can search and get it. The next important thing is most of us do this. Sit like this at home and watch TV. And this has two messages. One, you're sitting, and two, how much do you sleep? So sleep is very, very important because today we say 7 to 9 hours of sleep. We used to say 6 to 8 hours. Now, how many of you actually sleep 6 to 7 hours every day? Let's ask Dr. Manju how long she sleeps. Dr. Manju, how long do you sleep every day? Next we'll ask 7 minutes? 7 hours? And Malini, how long do you sleep?
Maybe 6 hours, sir.
Now, what you're going to get is if you don't sleep 7 hours at night, these people get dementia early.
Oh my God.
I think high time you increase your sleep.
Yeah.
That's the most important, most scary thing. So sleep is very, very important for several factors. Very simple thing that mistake we make is drink plenty of coffee. Cut down your coffee, increase your physical activity, moderate alcohol use, get a good exercise, you just sleep well. And at night, if you can't sleep, please don't use your mobile. What people do commonly, they take the mobile, that blue light prevents them from sleeping. You just keep going on, watching that. It's not going to help you. So mind you, sleep is very, very important component when you want to prevent a heart disease. That's very, very important. And you have to remember good sleep is important. Now, how long sleep? We said it's going to be 7 to 9 hours, but I think 6, 7 hours at least is going to be mandatory for you to maintain good sleep for these people. Next, if you start looking at what else can be done, how much of sleep do Indians have? The average sleep Indians seem to be doing is not 6 to 7 hours. It is much less. It's about 6.5 hours is what the Indian sleep pattern is. That is also a little less. There are some countries which sleep well. French seem to be sleeping very, very well. Maybe I should try and plan to migrate to France for this. Now, the second thing I showed you there is sitting. Sitting today is the new smoking. All of you sit in office, keep tapping your laptops, and sitting is equivalent to smoking because it can produce as much of bad effects. So how do you overcome this? But you don't have a choice. You have to sit to work on a computer. So how do you overcome this problem? How do you overcome this problem of sitting for plenty hours of time? Now, there is a scientific solution to it. If you're going to be sitting for more than 4 hours, it is detrimental. How do you overcome this? Increase your physical activity. A minimum of 150 minutes of physical activity will nearly overcome your problem. So what you do the ideal physical activity, you can still set, the risk is reduced, it's not removed. Unless you do a very strong exercise, more than 300 minutes per day, it cannot be removed. But at least good physical activity. So take a break, keep walking once in a way. Every hour, make sure you take 5 to 10 minutes break and start walking. It really makes a big difference. Remember, I said sitting is the new smoking, and how many of you smoke? I don't know. I don't know what is your smoking policy in the Hindu, but smoking, there is only one important thing that you must understand. It is one of the most important causes of death. 1 in 5 deaths among men and 1 in 20 deaths among Indian women attributed to smoking alone. No other risk factors involved. And we are talking about people who are 30 to 70 years of age. Current smokers are the smokers who are less than 6 months. And what was alarming most was that the average age in which WHO says Indians start smoking is nearly 18.7 years. So, but less than 19 years, most of the people start smoking. So, this is a very important theme. I think all of you should go for it and stop the smoking at a very early age, because it can be detrimental. The answer to smoking, very, very simple. Just stop. There's nothing like reduction of cigarettes. Mind you, smoking 1 cigarette a day gives you 50% plus of the risk of smoking 20 cigarettes a day. So smoking is absolutely out. Just stop smoking. Even don't say I have reduced smoking to 1 cigarette, 2 cigarettes. It is not going to work. The next is blood pressure. Now for this, I have a very simple question. What is normal blood pressure? There's no point asking Dr. Manju about this. I think we'll ask Malini and who else is there. So anybody else wants to answer. What do you think is normal blood pressure? Jasbir is also there. Maybe we should ask her also some questions. Yeah. What do you think is normal blood pressure?
So 120/80, sir.
120/80. That sounds good. But today, there is a very interesting definition of blood pressure that has come up by the European Society of Cardiology. There is nothing like normal blood pressure.
Okay.
There is hypertension. If your blood pressure is more than 140/90, it is elevated blood pressure if it's 120 to 140 and 70 to 80 diastolic. Systolic and diastolic. I'm sure all of you are aware of that. If your BP is less than 120/70, it is called non-elevated blood pressure and not normal blood pressure. So you should ask me, isn't there a normal person at all? I think that's a logical question that should be coming in for you. Now, what is interesting is that the risk for the blood pressure starts at 90 millimeters and progressively increases. So this classification of hypertension and normal blood pressure is only for treatment purposes. So anybody with an elevated blood pressure more than 90, you institute what is called as lifestyle changes, what we had already discussed, the good physical activity, good diet, avoid excess salt. And that is going to start at a very early age. That is very, very important, because starting from 90, it starts. So if you're going to leave it, you're going to have more and more risks and more complications that are going to happen. Having diagnosed hypertension, how low should you bring down your blood pressure? Now, this is defined very well this year. The target blood pressure is 120 to 29, the upper systolic, and 70 to 79 diastolic. Now, for the first time, there has been a guideline which has beautifully explained these values. Previously, they used to say 130/80, some value. You can never achieve that value. So this has given a range, which I think makes it a little more scientific and easier for patients to, or people to understand. So this is the target and goal blood pressure. Now, there are some relaxations, like if you see here, the yellow panel here that shows that for older people, you don't have to be so strict. Bring it as low as they can achieve. But for younger persons, less than about 85 or even less than 60, definitely bring down your systolic, the upper BP, to 120 to 29. That's very, very important. Now, this picture also shows how to tackle with that non-elevated blood pressure. Remember, we said non-elevated blood pressure of 120 to 70. Then there is this elevated blood pressure. Non-elevated blood pressure, you just tell them good things to do. For this elevated blood pressure, there is a very, very important category which is often missed: women. Women who have had complications during pregnancy, especially the diabetes, the hypertension, the preeclampsia, fetal loss, anytime they've had an abortion, anytime they have lost a fetus, and the intrauterine death, all those people are subsequently more prone for heart attacks. It's a very surprising thing which is neglected, because the moment the delivery is over and the blood pressure normalizes, people just forget the whole thing. That is where you should be very cautious. Subsequently, you are more prone, and those people should be taken care of more. You teach them lifestyle modification. I make it a point to tell all the patients with gestational diabetes and hypertension to take care of them after delivery. because that is the phase when they are going to come back with a problem again. So that's a very important thing that we should remember. So when a patient is diagnosed hypertensive, Dr. Manju gives you a drug. What will your person normally do? Dr. Manju gives you a drug like this. I'll just stop the audio. What does the person do? He goes to another doctor, and the other doctor will change the drug. So he is not happy. So he goes to some other doctor. He keeps jumping between doctors. This is what happens. Some of them are pretty dangerous. It's like playing with fire. You have side effects of drugs. So ultimately, what happens in hypertension management is very, very simple like this. Neither the doctor nor the patient knows which drug, who is taking what. Something is happening. They're not bothered about control till they can end up with complications, and that's what happens. Now, this is what keeps happening in most of the patients whenever I see them. The next important thing we'll talk about is cholesterol. I'm sure there'll be a lot of questions on that. Now, if you look at this blood here, you have the white blood cells, red blood cells, but look at the yellow ones. Those are the cholesterols. The cholesterol is pretty important. The cholesterol is something that goes and deposits in the blood vessels, and that is the one that produces the blocks in the blood vessels or the heart attacks. So what should be the cholesterol? I'm sure all of you have heard this story about the Good, Bad, Ugly. I'm sure everybody's seen that movie, Good, Bad, Ugly, with Clint Eastwood and Viola Skalak and Lee Van Cleef. This is exactly how cholesterol is described. Cholesterol is described as the good cholesterol, HDL cholesterol, more the better. The bad cholesterol is LDL cholesterol, more dangerous it is for you. Then you have the ugly cholesterol, which is triglycerides, which is not so bad, but it can also lead on to some problems. But today, what we have understood, it does not stop with just the three cholesterols, the good, the bad, and the ugly. If you look at this picture, it's not the good, bad, ugly that is there. There is a knife, there is a rifle here, and there is a noose here in the middle. There is another type of cholesterol which is as bad, if not worse than that, called the LP little a, which is called the deadly cholesterol. Now, this deadly cholesterol has been found to be 6 times more atherogenic or more dangerous than LDL cholesterol. How many of you have heard of your LDL cholesterol or your LP little a? I'm sure you have not even checked your LP little a. LP little a is the most dangerous cholesterol, and Indians of more than 30 milligrams, 25% have it. Every fourth person sitting next to you has got this LP little a that is elevated. So mind you, keep checking your cholesterol, not the regular cholesterol and control, but start looking at LP little a. Remember, I said we have a lower level of LDL cholesterol. Now, this is the European guideline, which says even at the lowest risk, you should have an LDL cholesterol of only 116. I don't know how many of you know your LDL cholesterol. I'm sure Dr. Manju has some annual health checkups that she keeps doing. And how many of you have maintained without any risk factors? We are talking about youngsters, people without anything, with an LDL cholesterol of 116. Now, this is the European guidelines. What about Indians? We said we have a lower value. The Indian guidelines is from the Lipid Association of India. I am a member of this. In fact, I'm one of the authors for this particular paper. We have said no Indian should have an LDL cholesterol that is more than 100 milligrams per deciliter. Now, we are talking about the bad cholesterol or the LDL cholesterol. It keeps going down as the number of risk factors increase. We will not go too much into that. That will become a very medical talk. But this is not the problem. The problem today is patient comes to Manju and then she gives a tablet. He goes to the lab, checks his value. He is diabetic. And once he is diabetic, he looks at this value. His LDL cholesterol is 75. All right. And the lab report says the optimal value is less than 100. So what will he say? The moment he sees that, he says, my doctor is over treating me. My doctor is giving too many drugs. Now, mind you, if you see this picture very carefully, the biological reference value that they are given is not meant for this particular person. It is for normal people. For a diabetic, the LDL cholesterol has to be 70, which is not even mentioned in the report. So please don't go by your lab reports and start self-medicating and changing your medication. It's very, very important. Because if you go by these reports, which is much worse for cardiac patients, the goal LDL for them is 50 LDL cholesterol, less than 50. Now with this 100, most of the patients feel this. So what I write it down to these patients and tell them keep it less than 50. And that works. Unless you give it very, very clearly, please don't go by the lab reports and be careful. Now, this is something that is for most of the youngsters who are going to be here. There is something called cumulative loading of LDL cholesterol. Let's say you're 40 years of age. Your LDL cholesterol is 150. Your age is 40 into 150. That is your plaque burden. Look at the left, the total plaque burden. And that is going to be 40 into 150, 6,000. Look at this value. At 5,000, heart disease starts developing. This is called cumulative loading. And this cumulative loading is very important. Look at the three lines. The one with the red line, which shows 200 milligrams, that person reaches this at 20 years. Look at this person with the 125 LDL. He reaches this by 40 years. Look at the one with an 80 LDL. This reaches beyond 60 years. So what you can do is not only this LDL is cumulative. As more time is there, more of the cholesterol gets deposited. So how do you treat these patients? You can change the trajectory by treating these patients. The straight line, look at the yellow line. You can change it by treating them adequately and delay the increase in cholesterol and delay the problems that can happen. This is very, very important. You can change the trajectory. Not only that, look at what is happening on the right side. You not control only the cholesterol, you control the other risk factors like the LP(a), bad cholesterol, good cholesterol, ugly cholesterol, diabetes, hypertension, smoking. You reduce all of those, you're going to reduce the risk further. So heart disease and prevention of heart attacks is not just unifactorial. It's a multifactorial disease. And as you have more and more persons out of control. Now, there's a picture about hypertension showing as the hypertension, the control gets poorer, the incidence of heart disease and cardiovascular complications start increases. So your baseline cholesterol, on treatment cholesterol, the duration outside control is bad. The second thing is variability. All the three diseases that I said, diabetes, hypertension, and cholesterol, have inter-individual variability, time to time variability, visit to visit variability. Unless you have a consistent value, these variabilities also can lead on to complications. So remember, it's not just taking drugs once in a while. Consistent drug intake is going to be very, very vital. The last portion I want to talk about is diabetes. Diabetes, the simplest way to measure is going to be your 3 months average of HbA1c, not just your fasting postprandial, which you can cheat by being on a good diet for a few days. If your HbA1c is less than 5.7 is normal, 6.5 is diabetes. So there is a portion called pre-diabetes. Now here also you should understand, compared to a person with HbA1c, which is very normal at 5, even at 5.4, which is not even pre-diabetes, the risk starts increasing. So none of these are fixed values. So having a lower value is better. And today we are saying lower the better and lowest is the best. It doesn't create a problem. You have a lower level of sugars and you can't get into hypoglycemia or low sugars in a person who's not on medication. So unless you're going to be starving and you're going to be on a fasting state. So there are multiple risk factors, duration, and checking your urine examination. If your diabetologist is just checking the sugars and treating you, please change your diabetologist. It's very important to look at your kidney parameters, your eye, the nerves, and your urine examination, because all these are markers for future heart disease. There are several complications which happen, and treatment of diabetes is to avoid these complications of heart attacks, stroke, kidney disease, eye problems, and nerve damage. It's very, very important. So if you treat diabetes, remember, it is not just treating diabetes, it is treating all the associated diseases. So how do you prevent complications? Remember these targets. Your HbA1c of 6.5 to 7. Keep your body weight or a body mass index less than 23. You can calculate it easily. Base circumference less than 90 or 80 for women. Get your LDL cholesterol less than 70. The triglycerides or the ugly cholesterol less than 150, and your blood pressure 120 to 129 systolic. It's very, very important. So treatment of diabetes is not control of sugars, it's prevention of complications. And that is going to require control of all these 4 factors. So finally, ladies and gentlemen, we have said the good 8. We said 4 important factors. That is going to be the sugars, the cholesterol, the blood pressure, and nicotine exposure. We have said the importance of that. We have also said that diet is important. Physical activity balance will maintain your weight, and sleep is also of utmost importance. So these are all the important factors. I think Thiruvalur very beautifully said, Noi Nadi, Noi Mudal Nadi, Adu Thanikum, Vai Nadi, Paipachayal. So you have to go to the root cause of all the diseases. Now here, and I will tell you, when I was a postgraduate and I was doing my DM cardiology, there was an IAS officer who was the special secretary to the then Chief Minister of Tamil Nadu. He had a heart attack when he was about 61, if I remember right. Just retired. He was the special secretary to the CM. He had a heart attack. He came in. I happened to know him before. My father's friend. So he said, Prabhakar, tell me, why did I develop this? I have done everything right. I have walked every day. I have had the good diets. I have done everything. So why did I get it? What is your answer to that, gentleman? Simple. This disease has multiple risk factors. There are some pathological diseases, causes like cholesterol, the blood pressure, the diabetes. There are some other diseases which we don't, like rheumatoid arthritis, or if you have joint problems, HIVs. The gut microbiomes are also the newer emerging data. Personal risk factors like smoking, physical inactivity, unhealthy diet, obesity, psychosocial factors and stress, which I have not spoken about, lack of sleep, gender-specific risk factors we discussed. But apart from that, you can't change much of this. The socioeconomic status, education, urbanization, pollution, and an aging population. Increasing age is a risk factor. Anybody who gets a heart attack beyond 50, you don't have to think about other risk factors. Aging is an important risk factor. You just delay. So what else can you do? This is something I thought will make all of you happy, because just being optimistic and saying that you can do something has been scientifically proven to reduce the all-cause mortality. So just be optimistic, be happy, hope that you get a promotion in your office very fast. So with all this in mind, I went to Sarnath. How many of you have been to Varanasi? I don't know. Sarnath, and you can see me sitting there and trying to pray to get some wisdom under the Bodhi tree. This is the Bodhi tree there. And this is Buddha doing his first sermon in Sarnath. And ultimately what I found out was very simple, that if you are going to control heart disease, it's not going to be very difficult. You can't win them all, but if you try, you can do it. But what you should remember, early and consistent thought process and action should be there. Thank you very much for the opportunity. Thanks to Dr. Manju for inviting me and Malini for having me today. I hope I'm not taking too much of time giving you a lot of stories.
No, not at all, sir. It was really
Very
very interesting and informative. You started with a positive note, telling that Indians, we have a lesser percentage of the cholesterol level. It can be a little higher when compared to the other groups. And you also ended on a very positive note. But there was a lot of sensitizations, what we were not aware of earlier, especially about this pregnancy and women and this elevated, values, elevated, I mean, blood pressure, as you say, elevated, non-elevated, and all that. All these are something really new and different to us. It's a real wake-up call. I think we have to take it, a little seriously and start thinking on those lines that you have told. And the major thing that we are very happy about this talk is you were talking a lot about prevention and lifestyle changes. So I think your thing of intervention, a cardiologist is something that we can try to balance it back and bring it back into the right track. So thank you, sir. There are some questions I think that have been put up. Can I read it for you, sir?
Yeah, please. You can answer. It's not a problem.
Yeah. So there's an anonymous attendee who said, yoga practice, will it reduce sleep quota? Is it true?
I don't think so. Yoga actually increases your parasympathetic activity and brings down your pulse rate. In fact, the American Heart Association has recognized Raja Yoga as one of the important factors, lifestyle factors in prevention of hypertension.
Oh.
There have been major papers on hypertension and yoga published by the Delhi group of Dr. Upendra Kaul. And they have shown clearly that there is a clear benefit of doing yoga in these group of patients. It's been very, very beneficial.
So it will increase the sleep. It doesn't reduce it.
It reduces your pulse rate. And basically,
okay.
I don't know whether you are aware, there was a beautiful article in Nature which says that the number of times the heart beats in any being, it's not human being, is going to be the same. Like if you see the animals that live for a long time, like tortoise,
Yes,
they
sir.
have a heart rate of about 30 or 40.
Okay.
The squirrel dies very fast. It has a heart rate of 220.
Okay.
So the number of times the heart beats is very, very important. So it's the same for everybody. And if you look at the yoga is going to reduce your basal pulse rate. And that in terms helps you.
Okay. And there's a next question which says, I am on statins. Is it okay if I have low-fat milk daily for my protein requirement?
You are correct. You can have it. Now, there is a very interesting thought. I thought I was actually expecting a different kind of question on this. Let me add to what can be done on this. Basically, everybody says whenever your cholesterol levels are high, and they say, no, don't worry, doctor, don't give me statins. You would just tell me what to eat and what not to eat, and I will exercise and bring it down. Now, mind you, 80% of the cholesterol is synthesized inside the body.
Yeah.
It's only 15 to 20% you manipulate by your diet and your exercise. So 80% when the body synthesizes, your exercise can have a contribution, but most of it, you will require medication. So lifestyle modification is important, but then it's also going to be a little bit of diet to reduce the number of tablets. Your low-fat milk for protein intake is good. I think it's fair enough.
Yes, sir. There's another question talking about dark chocolates. I heard that dark chocolates are good for the heart. Can I have it daily?
You can have it, but make sure you don't put on weight. You must also understand that they contain calories. So if
Okay.
you're going to have plenty of dark chocolate, you're going to become obese. Your stomach starts coming out. And once you start getting abdominal obesity, that is one of the very important drivers of inflammation.
Okay.
And inflammation today is one of the major risk factors for getting a heart disease.
Yes. Another query is about magnesium. Everyone is talking about magnesium and how good it is for health. Should I take my supplements?
It's not routinely recommended. Magnesium as part of your routine dietary intake. If you have plenty of fruits, vegetables, all those things, that's fair enough. They all contain magnesium. And even your dairy products and whatever you take contains magnesium. Magnesium has an ability to stabilize the membranes, the cellular membranes.
Okay.
It is specifically more useful in some group of patients, like patients who have irregular pulse, like what we call as arrhythmias. So those patients, when you give magnesium, there is some benefit because it stabilizes the cellular membrane and the instability is improved. But if you have a low magnesium, which doesn't happen very often, it is usually associated with low potassium also, which happens in a chronic vomiting or a chronic diarrhea. There should be some cause for it. In those cases, then magnesium supplementation is beneficial, but routine magnesium supplementation is not recommended. The other thing that magnesium has been found to be useful is sleep. Somebody asked a question about sleep in the beginning. Now, magnesium oxide and melatonin, instead of taking sleeping tablets, what you do is give melatonin. If you give 3 milligrams or 5 milligrams of melatonin. So what is melatonin? Simple. When you sleep, your brain produces this melatonin. So it simulates normal sleep. And magnesium oxide is also there. So these two put together are beneficial in providing you a good sleep. And it's like physiological sleep. It's non-addicting.
Okay.
That's the important thing.
Okay. Yeah, thank you, sir. Another query is, I don't think that my diet is giving me sufficient protein. Can I take protein supplements? Can you suggest anything?
Proteins are generally, if you're going to have your chana, rajma, all your dals and all those things, they have enough protein. I don't know how you calculated your thing. Maybe you should meet a dietitian and take a proper recall of your diet and see whether you really have this problem. If you have this problem seriously, then you have to be supplementing proteins. If you're going to be non-vegetarian, it's going to be the egg white is the easiest protein that people do. If you've gone to a gym, this question is going to keep cropping up whether you'd. But too much of protein is also not very good because your kidney has to eliminate all these proteins. So be cautious with that. If you're very much in doubt, meet a dietitian, do a diet recall, and do a proper counseling rather than trying to take some advice off the cuff.
Yeah. Another person has asked, what is your take on Ozempic? OZEMPIC.
I know what.
Yeah, for weight loss.
Can you get this person online for me to ask one question? How did they know about Ozempic and why are they into this? Have they read about the good and the bad of Ozempic? Ozempic and if you can get that person, we can directly ask this question to them. Ozempic is
Put as
semaglutide.
anonymous is there. Maybe whoever's posted this question.
You want to come in, you can come in and ask. I can tell you, I'll tell you what it is. Now, the problem with Ozempic is semaglutide. So when you start taking semaglutide, there are two drugs like that available in India. It's not only Ozempic, Mounjaro is also there. It's tirzepatide. Tirzepatide and semaglutide, all these drugs. So they reduce your appetite. They are GLP-1 receptor agonists. And they bring down your weight by about 15%. Now, there are two important things that you must remember. Side effects. The biggest side effect for these patients is your gastrointestinal. They lose their appetite. They lose their appetite. So you have to be a little careful with them. Second thing you must remember is if you're having a thyroid problem or if you have a problem with the eye, there are certain contraindications where you can't take Ozempic. Not everybody takes Ozempic over the counter. The other drug called tirzepatide also is there, and that also can produce 15 to 20% weight loss. But what is important is not the weight loss. It is not just the fat you lose muscle also. Okay. So whenever you take any of these weight loss medicines, you lose fat, you lose muscle. So it is very, very important to do strengthening exercises or weights. Your muscle strengthening exercises are very, very important because what happens is you take Ozempic, fine. You're losing weight, fine. You're losing muscle, you want to stop. You stop, no problem. The moment you stop, you will regain everything only as fat. The muscle doesn't come back.
Okay.
So you're doing more harm. And most of the patients, when you stop Ozempic, you will regain the weight. It's not just a kickstart. It has to be continuous. And once you start taking this, please remember, you're going to take it for life also. The weight loss gradually comes back. So you will start losing weight. And this is very important thing is to start looking for weight training. Because a lot of people have done this without doing the weight training and they become very weak. So be very careful.
Okay. So thanks, sir, for that caution. Ghee is good or bad for health?
I think the answer to this is more or less same as what I gave originally, saying that the fat is actually only one portion of that can happen. You can have a little ghee. It's not that ghee is banned. The only thing I keep telling is that remember, whatever you take, take it. But remember the number of calories it contains. And everything has got some good, some bad. In fact, the next question, I will take it one step higher and ask you, people keep asking, what is the kind of oil that I should have? Should I have sunflower oil, safflower oil, or this linseed oil or whatever oil? See, every oil has its own plus and minus. Some have monounsaturated fat, some have polyunsaturated fatty acids, some have lecithin. Everything has got a small benefit. So which oil should I have? Simple. There was one of these cardiologists from North Karnataka. He used to say, he used to post a picture of his wife with 4 types of oil. So he says, when I cook with mustard oil. Whenever we garnish, we use gingerly oil. And whenever I make dosa, I make it with sunflower oil. So what about all these extra virgin olive oils and all those things? All those things can be used only on salads. They become very rancid if you try to boil it for the Indian cooking. So it won't work there.
Okay. Fine, sir. Thank you. There is a lot of noise about not taking fruits along with lunch or dinner. What is your opinion on that?
I don't know what noise is that. I don't think there's anything wrong in that. You just take your calories, take your fruits, take your vegetables. In fact, I gave you portions. I gave you the food pyramid showing
Yes.
plenty of fruits and plenty of vegetables. And in fact, there is a concept of the food pyramid is what I showed you. There is a concept of the food plate, which is also good more for diabetics actually.
No,
In a
I
food
think
plate,
this person is talking more about having fruits along with lunch or dinner because some of them say that you can have it before you have your meal.
idea is if you take it before your meal, your appetite comes on, you don't eat much.
Okay.
So this food plate concept is what I think is very simple to follow.
Okay,
Food
sir.
plate, when you have a plate of food, 50% is going to be vegetables.
Yeah.
25% is going to be rice or chapati or potatoes. Potatoes comes there. Another
Yes.
25% is sambar, dal, or whatever you have, that is the proteins. So this is going to be a food plate. Have it for every meal.
Okay.
That is the most healthy way of eating food.
Fine. So, a lot of questions on diet. What about chia and sabja seeds and pumpkin seeds? Are they good for health? Because a lot of diet and weight loss, they are using this, no, sir?
Yeah, all these things have some beneficial effects, but not primarily recommended for routine things. But all these have antioxidants. So
Oh.
there are some benefits of taking these antioxidants. Routine supplementation is not required, but you can take all these, no harm in taking all these. You can take all these things. But remember, totally, like the reason why I showed you that slide on that time restricted eating or the intermittent fasting was to tell you, if you're planning weight loss, the total calories is more important. It's what you eat and what you burn. Balance the two. There are certain things that increase the basal metabolic rate. For instance, if you take some of these green teas, how do they work? How do you lose weight with them? See, basically it increases your basal metabolic rate. It increases it's like taking this caffeine or what is there is the stimulant in that is going to increase your metabolic rate. And that is when you start losing weight. So it is there.
Okay. There's another question about the number of meals that we can take per day. 5 meals a day or 3 meals a day, which will be suitable, sir?
Whatever you like, yeah, take it, no problem. But remember what calories you're taking. If you like 5 meals a day, take 5 meals. But if you're going to take 5 meals, you make it healthy and make sure that you're burning out all the 5 meals. There's absolutely no problem.
Okay. Another question about Ribelsis. I use Ribelsis 14 milligrams, but nowadays it is not having any effect on my weight loss.
This anonymous attendee is the same person who's asking the same questions. Ribels is nothing but oral semaglutide. So it is in fact, my own experience with my patients and Ribelsis has been very poor because the weight loss with the Ribelsis actually is at 25 and 50 milligrams, which is not available in India.
Oh,
And now that Tribals is available as injections here, Ozempic is not available in India. What is available in India is what is it, Monjaro, and this one is called not Ozempic. It's called something else. So it is available as some other brand, oral semaglutide. You can probably go for the injectable. The reason why you're taking such a high dose, there the dosage is just about 2.5 milligrams or 0.25 milligrams. Because here the dose is 14 milligrams because the oral absorption of semaglutide is very poor. It doesn't work. So Ribels is orally that has more side effects and it's not going to work. You can probably try injections.
okay, sir. What about bananas? Bananas, are they good for diabetic and heart patients? People say it has a good amount of magnesium. Another question is, can we substitute stevia leaves in place of sugar? Is stevia safe?
First, you have to tell me what is stevia. Seriously, I don't know. The
I think
bananas,
it's that sugar free, sir.
yeah. So first question is the bananas. Bananas are, see, any fruit in limitation. In fact, diabetics are permitted 2 fruit exchanges per day. But it has to be the same. It has to be the calories. So for instance, what is a fruit exchange? It will be, if it's a big banana, half a banana, small banana, one banana, half an apple, or half a sweet lime. Or if it's going to be a mango, one big piece of mango. If you some equivalent amount of fruits, one portion of pomegranate. So any fruit is fine. It's going to be a fruit exchange. And the bananas are good because they contain plenty of fiber, good source of magnesium, and very good source of potassium, actually. And potassium and magnesium are very good for reducing blood pressure also. So it is a good one. Stevia leaves are sugar supplements, or if you're talking about, I don't know whether it is the Karpati vellam that you're talking about, or the vellam that you're talking about. Okay, there is some benefit of that because the jaggery, as we call it, has plenty of iron.
Iron.
It's a very good source of iron, and in fact, the black jaggery, as we call it, or is supposed to be very good source of iron. Stevia leaves, seriously, I don't know what it means, but any supplement of sugar, you have to be cautious. You go to these shops, they tell you that we give you sugar-free sweets, but they are supplemented with fats.
Okay.
So mind, look at the calories. That's very important.
Yeah. Yes. There's one question about heredity. I think I just skipped that. One thing on liquid diet. Liquid diet, will it be the right thing for us to reduce weight? If it is, so what type of liquids will be good, like buttermilk or juices for weight reduction, sir?
It's not like that. It's only the calories. I told that again. It's the total calories you get in and the total calories you get out. And second problem with liquid diet is without fiber. If you're going to take a liquid diet, it is going to be there. And mind you, the fruit juice is not the same as having a fruit.
Fruit, yes.
So having a full fruit is better than having a fruit juice.
Okay.
So I think you should go for a fruit because it contains a fiber. Second thing is the glycemic index is less. I'll give you a simple example. You want to take one glass of sweet lime juice. You're going to use about two to three sweet limes. To take one sweet lime, one full satukudi is not easy. You can finish one satukudi. That's all you eat. And it goes with the fiber. The glycemic index is less. The glycemic index, basically what it means is the absorption of sugar is much more when you start taking it as a juice. So it's better to have it as a fruit. And solid food is generally okay.
Yeah. Yes, sir. Is it possible to control heart disease, which is by heredity? That's what. Parents or forefathers, if they have, then it definitely comes to will it come to the next generation? That's the question he's posted.
Yes. So family history of heart disease is actually defined a little differently.
Okay.
The family history of heart disease is actually family history of premature heart disease. So what is premature heart disease? My grandfather having a heart attack at 75 is not heart disease.
Okay.
So a male member of your family who's going to be your father, mother, brother, sister, the closest relative, male member less than 55 years, or a female member, again, mother or sisters, less than 65, having a heart problem or a stroke or a peripheral vascular disease. So it has to be atherosclerotic disease. It could be a heart attack or a stroke, or it could be a peripheral vascular disease of the legs or the hands. At this age, if somebody has got it, it is family history. So what about my uncle, my aunt, I think they're all your relatives. It's not family history. I keep telling this very often. So the family history is clearly defined. And is it possible to change it? Yes. What you can do is you can't change your genes. That's a genetic factor.
Yes.
What you can change is all the risk factors I told you.
Yes, prevention.
So you go for the risk factors and do it. And early treatment of risk factors. So if you look at your father or uncle, mother who has had a heart problem, you go and search. They will either have a high cholesterol or blood pressure or something. Something is usually abnormal. Usually it's the cholesterol that's abnormal. I have had a patient who has had a familial hypercholesterolemia and died at 6 years of age. 6 years. And she had cholesterol swellings. That's something like the size of about 2.5, 3 inches sitting on her body. Her sister has got the same problem. Now she's going in for a very expensive treatment. So all these are there, but you can't change the family history, but you can change the other risk factors. Now for the future, for somebody who's interested, future, we are doing gene manipulations. Now maybe about 20 years down the line, if you ask me this question, it'll be reality. I will say, yes, you can do it. It's still very experimental. There was several meetings on this. We are going to, this topic is not yet closed.
Okay. So what about the silent attacks, sir? They generally say, this is my question. Many people say, like for diabetics, you end up with a silent attack.
So these silent heart attacks are more often neglected heart attacks. So who are the people who neglect these heart attacks? Very simple. Women and older people. So you tend to refuse that you have a heart attack. You say, no, I had some belching. That's all. It's an indigestion and this and that. Go and take an ECG. This is what happens. And so very often people just ignore symptoms. You go carefully probe, you'll find it. The other important category of people who have these silent heart attacks are the diabetics. Because of their neuropathic pain is relieved. They don't have pain. So this is very, very often seen. So you have to be very, very careful. So these patients have to be treated very carefully, and routine screening, at least with an ECG, to find out if there's anything fresh in diabetics is very, very important. Nothing wrong. You don't lose anything much by just taking an ECG. It's not very expensive. 100, 200 rupees, you can take an ECG in most of the places. So if you do a routine ECG screening, you can pick up these attacks. Now it's a warning sign, because if you have one heart attack silent, your chance of getting a second attack are much higher. So your preventive measures are to be very strict and treat again. So I think it's more important to identify those people.
So there's nothing like a golden period, no? So like once you have a discomfort or chest pain, it's better we go and check it out immediately. Like rather than postponing it by saying it's a gastric problem or I know it's indigestion and all that. Isn't it, sir?
It's a very good question talking about the golden hour. That's very, very vital.
Yeah, because for stroke, we have heard that,
This is
by the time,
important. It's important everywhere. Even heart attacks is the same. It's
so
very, very
there is a
important.
period.
Time is muscle. The more you delay, the more the damage is. And the heart attacks that happen in diabetics especially are smaller attacks. They've had an attack. Larger attacks would have presented with breathlessness. They would have had some symptoms because the amount of volume. So let's say you have 5 fingers. You try to hold with 5 fingers, right? Your power is good. This is normal heart. You lose 1 finger. You use the 4 fingers. It's not much of power that is lost. You can still do most of the activity. But if you lose 2 fingers or 3 fingers, definitely power comes down. So it's just these smaller attacks that are usually silent. But the death in heart attacks is not just the power. It is the irritability of the heart. When it starts getting a heart attack, that area becomes irritable, and that produces what, remember I said, these arrhythmias and irregular pulse. Most of the time they kill. The heart becomes unstable. So that is the point that the death happens most of the time. So what happens in a large heart attack, if you come early, you open the vessel by doing an angioplasty or a lytic therapy, or give some medicines and open up the vessels. You restore the blood supply, the damage is restricted.
Okay.
So nothing wrong in taking an ECG. I think it's fair enough.
Okay, sir. Fine. And thank you, sir. Is it more beneficial to eat soaked dry fruits like almonds and walnuts?
Yeah, they say that there is some benefit in that. So these are all small things that do benefit. Walnuts and almonds, all these dry fruits have calories. I always keep telling them, but remember, they also increase your good cholesterol or HDL cholesterol. Today, the concept of HDL cholesterol is a little different from what we used to talk about before. Before, we were trying to give medicines to improve good cholesterol. That doesn't work. Physiological increase with all these things and good physical activity is the only one that works. It is beneficial to increase.
Okay. And talking about this cholesterol, how do we reduce LDL cholesterol?
LDL cholesterol, like I said, physical activity, your diet and exercise, 15%. But subsequently, what happens is that you are going to have medication only depending on your target. There are goals for you. I think you should talk to your doctor. But what is going to bring down your LDL cholesterol specifically are the medication.
Okay.
This gentleman has asked something about Ozempic. I'm not asking Ozempic, Ribelsis.
Yes, sir. A follow-up question is there about the person who had asked about Ozempic. It says, no, I didn't ask Ozempic. Something, the other tablet called Ribelsis was giving me excellent
Oral
results, but now
semaglutide.
not working.
Ribelsis is oral semaglutide. Now, oral semaglutide, yeah, it is going to work. In fact, I don't know whether he is not. I have my own experience in oral Ribelsis. I tried about 15-20 cardiac patients to try to reduce weight. 2 lost weight. Others, most of them dropped out. He's been a responder, but that's all will be the response. It'll taper with about 10 to 15. It's not going to keep on losing weight.
No.
That's all. You will reach a plateau at some point. It's not going to be beyond that.
Then there's another question about millets in diet. Are millets good and
Yes.
are regular for to be used in the daily meals?
So
Regularly.
2 important benefits of millets. The glycemic index is less. It's good. These are good to have millets. Millets are going to be a good supplement. So whenever you add any food, like even if you have idli, dosa, whatever you have, you add the millets, the glycemic index comes down. So add one of these powders and take it, and they are much better than any of the other things. So I straight answer to your question is yes.
Yes. Okay. There's another question with diabetic and low BMI, body mass index. What suggestions to improve the muscle mass other than strength training?
It is a very difficult question. With diabetics and low body mass index, there's something called the lean fat Indian. So that is, I don't know whether she's driving at that. And if you're talking about the lean fat Indian, see, Indians may be thin, but their amount of abdominal fat is very high, or the visceral fat is high. They are more prone for heart attacks and problems. Improving muscle mass, 2 things happen. One is you have to make sure that you are taking adequate amount of proteins. 2, protein supplementation. 1, and second is muscle strength training. These are the only things that's going to improve your muscle mass. And probably to answer to your question, other than strength training, which I was telling initially, you probably have to supplement a little bit of proteins.
Okay. So with this, we come to the end of the question, sir. So really thank you, Dr. Prabhakar, for such an excellent and very interactive and informative session, and for explaining all these queries, so patiently amidst your very, very busy schedule. And we are happy that you were able to spare this time to sensitize us on a very important topic of great concern. Especially, these youngsters. And another thing, what I wanted to ask you is, sir, nowadays we hear a lot of incidents where people die on the dance floor. They suddenly collapse and they have a heart attack and die. Is there any specific reason?
Similar to the sudden deaths of that happen in youngsters and exercise that they do, 2 or 3 things are to be remembered. One is whenever you do all this, hydrate yourself well. Make sure you are drinking enough water. Don't get dehydrated. If you get dehydrated, blood becomes thick, and that is more prone for clotting, and you're going to get a heart attack. And exercise beyond 60 minutes, not really generally beneficial. Your dance floor problems are all problems that happen because of the overnight dancing, plenty of over physical activity, similar to the exercise. And third important thing is alcohol. Alcohol will dehydrate you.
Okay.
So most of them drink and dance. So when you drink, the general rule is you have 1 drink, give 2 hours gap. If you have 3 drinks, give a 6-hour gap. This is one of the things that we say. So, and hydrate very well, drink plenty of water, and that is going to be important. The other thing is your warm up. You go start jumping and dancing. It's very important. Whenever you see an athlete, look at Usain Bolt, or look at whatever athlete you want to see, they warm up and then do exercise. It's similar to your dancing. You jump up and down, please have a slow dance, start increasing your activity little by little. Without the warm up, your body doesn't get tuned to good physical activity. So warm up and cool down are very, very important.
Thank you, sir. Ma'am.
Thank you, Dr.
Your ma'am calls me, I can't refuse. So I should say thanks to Dr. Manju for calling me here.
Thank you. It's been a wonderful talk, and I think all our colleagues got benefited with it. Thank you so much, and thank you for valuable time.
Thank you very much. Thanks, doctor. Thanks to all of you for joining in.
Bye, sir.
Thank you. Bye-bye.
Thank you, Malini.
Bye. Welcome, ma'am.